is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Puke Nemo.
Are you pregnant and have a stuffy nose all day long? I bet you no one told you about pregnancy rhinitis, so I will, because 18 to 24% of you will have this unexpected, wonderful side effect that the majority of you will actually struggle with. It's the stuffy nose. So let's learn more about why pregnancy congestion is common in today's episode 53, Pregnancy Sinus Congestion. And what can I take for pregnancy congestion? Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. And get 25% off using the code PUKE25. That's PUKE 25. Or just go place No More Nausea Band on your baby registry for your delivery room bag at Bye Bye Baby, or get it shipped for free in just 2 days as an Amazon Prime vendor. And know your little ones are always taken care of with the first No More Nausea Kids and No More Sleepless Nights Kids, which works on moms with small wrists too, who just want a good night's sleep. Now available at your local CVS store. Want to hear some pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time anyway, with hilarious stories like booty and brains, puke poodle, chipmunk cheeks. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind pregnancy nasal congestion, why 1/5 of all pregnant women get it, the symptoms of pregnancy congestion, which can lead to headaches, and 6 natural ways to help naturally relieve your pregnant nasal congestion. Stay tuned.
The science of puke, pukeology.
So vomiting, nausea, fatigue, and heartburn. Those are all some of the symptoms that you might have expected to happen early in your pregnancy. But there's one pregnancy symptom which might not have been told to you, called pregnancy congestion, also known as pregnancy rhinitis. Yes, it's in your nose. This congestion actually affects 18 to 24% of all pregnant women and can occur anytime while you're pregnant. Did I tell you the best part? It tends to last for 6 or more weeks, and most pregnant women find it ridiculously irritating during the 2nd and 3rd trimester. The good news is pregnancy congestion goes away a few weeks after you give birth, usually about 2 weeks postpartum, when your fluid levels start to return back to normal. So what causes pregnancy congestion? This condition is caused by a hormonal change that occurs during pregnancy. Your estrogen levels increase when you get pregnant. According to Baby Center, high estrogen levels cause the mucous membrane, which is the lining of the nasal passage, to swell. This produces more mucus. So pregnancy also increases the amount of blood flow to the mucous membrane, which is already swollen from your nasal passages. This is what causes nasal stuffiness. Your body also has to prepare for childbirth, which on average is a blood loss of about 500 milliliters to about a liter. So your body compensates by producing about 500 milliliters more throughout your pregnancy. Yes, you are like a walking bag of extra fluid, but don't worry about it. It's completely normal to lose blood during delivery, whether or not it's vaginal or a C-section. So when there's more fluid, hence you get those beautiful cankles. Anybody know what cankles are? It's when your calves and your ankles seem to merge. So you no longer have an indentation from a thick calf all the way down to a small ankle. Instead, they're kind of all the same size as your calf itself. So this merger is due to extreme swelling. We actually call it edema in the medical community, and you can see or judge the amount of pitting edema by how far down you can actually press on the shin bone and how far your finger compresses. This usually happens and is in extreme cases in the last trimester of pregnancy, but you will notice you're swollen all the way all around. So what are the symptoms of pregnancy congestion? When pregnancy is the cause of nasal congestion, the symptoms that you're pretty used to experience are often mild. These include nasal congestion, which means a stuffy or a runny nose. Sneezing can happen. Difficulty sleeping because you find it harder to breathe. You start to mouth breathe a lot. And a lot of women actually, we recommend, especially for pregnant patients, that they might want to start gargling with things like biotin and stuff like that, because as you're mouth breathing, you have to remember that you're decreasing the moisture that's actually in your mouth. Hence, sometimes a little bit of itchy throat is also common. Now, although it's rare, it can happen which bleeding in the actual nares. So if you have a lot of bloody noses, that can happen because you can blow your nose a lot. Another fun fact, besides producing 500 mLs of more fluid in your body as you prepare for birth, your platelets will actually decrease, meaning that you have a tendency to breathe more. So pregnancy in general decreases your platelets. That's the reason why before I were to put in an epidural in any type of patient or a spinal, we always check their platelet levels to make sure that they're not below 150. Now, other possible causes of congestion include allergies. This may affect about a third of women in reproductive age, and these are more severe symptoms. So they include itchiness. So itching, especially around the eyes, behind the throat. This is basically a sign that you just have allergies, especially when they're seasonal. So if you know that, it is a little bit more difficult to navigate if you're accustomed to taking an antihistamine or a medication such as Benadryl or all those other, especially during pregnancy, because you just don't want to give the baby any extra increased heart rate, sedation, things of that nature. Now, another symptom of actual allergies causing the congestion, not pregnancy itself, is severe nasal obstruction. So nasal obstruction can happen when you are so congested, again, from a histamine release. So the difference between it is in pregnancy, it's because of physiologic. Your nose is actually producing more nasal congestion or mucus, and there's more fluid. So you're just kind of like floating around in a lot of nasal junk. Versus when you have allergies, allergies are actually a cause of histamine. Histamine is if you've ever had an allergic reaction and you notice a raised redness or bumping on the skin, very itchy and things like that. That's actually what allergies are. So allergies are a histamine release of your body, and you're actually trying to protect it. But instead, what it's causing is massive amounts of swelling to the area, and that can cause severe nasal obstruction. So if you notice that it came on or that you've always had severe allergies, it could potentially get worse during pregnancy. Sorry to tell you. Can pregnancy congestion lead to headaches? Yes. Pregnancy may cause sinus congestion, which can lead to sinus headaches. Now, headaches tend to last days or even longer and can potentially get worse as you keep getting and moving forward with your pregnancy. Most headaches and migraines start to occur during your second trimester, which makes sense because your body is making more fluids, a lot of sinus congestion, you're getting a lot more mucus in the area. But sinus headaches are easily confused with migraines. So if you notice that you're having frequent throbbing of these headaches as they're getting worse, especially with noise or bright light, go visit your OBGYN, your healthcare professional, your family practice, because again, that is a sign and symptom of prolonged headaches, not curing themselves or ridding themselves in short periods of time. Those are called migraines. So to find out how you can stop a headache or migraine during pregnancy, visit episode 8, Pregnancy Pukeology Podcast, How to Cure a Migraine While Pregnant. Or you can try something natural called no more migraine during your second trimester, which is the combination of acupressure and essential oils into a 3-in-1 clinically proven natural way to stop the current headache and increase the length of time until your next migraine. If you want to learn more of how it works by increasing oxygenation, the distraction technology found inside the wristband, and why acupressure actually works for headaches, visit nomomigraine.com, or you can just check them out online and follow them at NoMoNausea on any social media site.
Throwing up on a Tuesday? One puke story.
After my second baby, I knew the headache was coming. These migraines were obviously my body's way of adjusting to hormonal fluctuations post-baby. So when it hit, we went to the urgent care. I left my baby at home with my husband, and I was so sad to have to leave her. I had to wait for quite a while for a doctor, and that's when I started throwing up. The only thing I could think of was to start going for it was my personal best, which I had a record that day, right? So again, 4 times to the bathroom, puking my guts out. Finally, the doctor saw me, and thankfully it was my favorite doc, and I had to get a shot in my booty. What? In my butt? Please? Seeing that I was 4-day postpartum mommy who had just thrown up in the bathroom 4 times, and now I was getting shot in the rear, it was only once that you have to live through this and that you're able to laugh at yourself. Thanks, Jane, for your booty ease story. On Easter, I went to a friend's house since my husband was deployed, and I was pregnant and couldn't enjoy all the festivities and played video games while he ate with his family. Then he brought me over a mountain of leftovers. I ate it all. Later on, we went to the convenience store and I bought 4 Lunchables, which I knew was a pregnancy no-no, but soon enough, I was about to learn that my body would reject it anyway. I ate all of them. Wow, in one sitting. The night he fell asleep on the floor, so I took his bed. Woke up at 4 a.m, leaning into the kitchen sink, puking my brains out, which I used to sleepwalk. Went back to get in bed, and when I put my head down, it went into a puddle, a big, smelly puke puddle. I clicked on the flashlight and saw the entire bed was literally covered in puke. I folded up the sheets, threw them in the laundry room, and walked 2 miles home in my own puke-covered pajamas at 4 a.m. This was definitely my favorite. I can see it now, walking home covered in puke. I just can only imagine what other cars thought of. My 2 brothers and I and a friend had all just eaten Olive Garden. I was driving, and my brother was in the front passenger seat. My youngest brother was directly behind me, and our friend was directly behind my brother. I've been driving down the road for a few minutes when my friend looks over and notices my youngest brother's cheeks are puffed out. He asked my brother, "What is he doing?" The youngest brother doesn't reply because he has a migraine from hell, but starts making desperate sounds and then just unloads a huge load of vomit directly into the back seat. Ew, and down the pocket. Everyone starts screaming at me to pull over. As I'm pulling into the gas station, my friend in the back seat opens the door and pukes as the car is rolling across the parking lot. That's when my other brother in the front seat directly ahead of him opens the door and starts puking. Finally, after the car stops, the combination of the smell and the sounds and the sights forced me to open my door and vomit profusely in the parking lot. It was literally a counterclockwise chain reaction, and I was the easiest one because I was pregnant. A few days later, I paid a car detailer to clean up my vomit mess. My car never smelled the same again. Ew. I thought, oh my gosh, it was definitely quite a while before I could eat Olive Garden again. Enchanted Bunny. That was hilarious. And I think I need to call your brother Chipmunk Cheeks after that. So do you have a hilarious puke story, a pregnancy puke story for me that you just can't wait to share? Send it to me. Pukeology, Pukeellogy at nomonausea.com. Let's try that again. Pukeology, Pukeollogy at nomonausea.com. nomonausea.com. Or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
So what can I take for congestion while pregnant? Well, you can help to ease your pregnancy congestion if you do the following things. Number 1, drink adequate amounts of fluid, 6 to 8 ounces of water. I say water, but it can be really fluids daily. This will help to thin your mucosa. So again, it'll help to thin out your mucus so it's not so severely thick, right? Stay in a moisturized room. Now, I know that sounds like, oil of Olay commercial, but it's really to utilize a humidifier, okay? Keep the air nice and moist, especially where you work or when you're at home, to keep those nasal and sinus passages going. Take a nice warm bath or a shower. And again, any of those radiating wonderful aromatics of the hot water, that usually helps to kind of drain out your sinus passages. Make sure that you're taking a look at your sleeping position. So if you use an extra pillow, it will elevate your head. This helps to prevent the mucus from building up and blocking your air passage, especially while you're off to sleep. And we all know that during pregnancy, you do gain a little bit of weight, and sometimes it's actually in the oral pharynx. So some of us women are not sleeping as well, but that's because of the fact that we may have been predisposed to obstructive sleep apnea. And now that we have a much larger neck and oral airway area, you might be actually obstructing. So you're really not getting a good sleep. So if that's the case, you may want to go take a look at a sleep study. Go find out, because again, it's really important for you to be able to get good restful sleep. They say 8 hours of sleep, and I hope all of you mamas will take my advice. So say no to nasal sprays. Let me repeat that. Say no to nasal sprays. This might actually worsen your pregnancy congestion. So only use sprays when they're prescribed by the healthcare providers. So the reason why is because nasal sprays generally tend to thicken the actual mucosa. So they're not going to thin it out like we want it to do. And not only that, but you can actually cause even more inflammation to the area depending upon what that is utilized. And we'll talk about it a little bit later, but some of these nasal sprays are actually associated with different birth defects. So it's important that you stay away from it. If you need to kind of wash out the nasal passages, I would say do a warm saline or like a salt water type. They have those neti pots that you can use. Yes, I know they're a little bit uncomfortable, or just an old fashioned, like a baby bulb syringe with nice warm salt water, and you can put that into the nares. Also, apply a washcloth to the face. Make sure it's nice and warm and wet, especially from the area of the forehead, the eyes, and all the way down your nasal. And if you want to kind of give yourself a gentle massage, start up at the top where, if you were to have your 2 fingers right where your eyebrows meet in the middle, go outward, and then from that same point, from those 2 eyebrows, bring it down your nasal passages and down towards your cheeks. You have to remember, ear, nose, throat, ENT are all connected together. So stuffy nasals can cause you to have stuffy ear holes, is what I like to say, or decrease the amount of hearing that you're feeling, and also pressure around the eyes. That's the reason why the most common side effect of headaches is going to be pressure, right? And then secondarily, it's also going to have an upset stomach, nausea, because a lot of times you're swallowing it. So make sure that you're really thinning out those nasal passages, and you're blowing your nose. Not too much, because again, sometimes it can cause bleeding. Are decongestions safe during pregnancy? No. Well, okay, let's be real, ladies. I can't tell you never use a nasal decongestant, but if you're thinking about using a nasal decongestant, you have a sore throat, a cough, nasal decongestion, sinus headache, they're actually considered not safe during pregnancy. According to recent studies, decongestions increase the risk for some rare birth defects, especially when they're used in the first trimester. And usually pregnancy-induced nasal congestion, different than actual cold and flu, okay? I'm going to put that as a caveat. Those usually tend to be, first trimester usually tends to be a cold and flu derivative. But once you get into your second and third trimester, again, the risk of birth defects are much less, because organogenesis, meaning the production and creation of the baby's organs happens usually between the 8th week and the 12th week. So you should try to avoid even over-the-counter decongestion such as Sudafed, Dristan, Mucinex, because they contain phenylephrine. Phenylephrine or pseudoephedrine, both of these can actually have been found to cause different birth defects of the gut, the ears, and the heart of unborn babies. Although the chances of your baby having a birth defect is very rare if you do take a nasal decongestant, but it's important not to put your baby at risk by avoiding decongestions. I also have a podcast and it talks about, is it safe to get a flu shot? And the answer is yes. And so again, you can look at why or when should you be considering getting a flu shot in episode 52. So ACOG, which is the obstetrics, kind of the big division of obstetrics, they actually recommend that all pregnant women should get a flu shot to decrease your risk, because you do have an increased risk of infection because your natural immunity has been decreased. Or I always like to say, instead of using medications and drugs, go natural. So try natural remedies to help to cure your pregnancy congestion. I gave you quite a few really good ones, and that's something that you can use consistently. You can also, what you eat. You are what you eat, and helping increase the amount of vitamin C, the amount of zinc that you're taking in through fruits and vegetables. Find all of that out in episode 52. Is it safe to get a flu shot? Now, when should you be worried about this nasal congestion? If it's not going away, right? If it's not going away and you're experiencing a fever above 101 degrees Fahrenheit, if you can't sleep or eat because you're literally so full from this gross mucus you have, and if you start coughing alongside of it. Usually, seasonal allergies, you'll feel the itching around the eyes. You might have very mild nasal congestion. And while you're pregnant, nasal congestion is very common. 1 out of every 5 of you will be bothered by it. But when it starts to progress even more, go see your OBGYN, go see your healthcare provider, and make sure that you're really staying on top of it, because the last thing on the planet that you need is to not be able to breathe right, to sleep right, and to really enjoy your pregnancy. Now, you've learned all the science behind pregnancy nasal congestion, some more than others, right? Some you've probably learned more than what you've ever considered. You've learned why pregnancy rhinitis is so common in pregnancy, the different symptoms of pregnancy congestion and how they can lead to headaches and what you can do about them, and also the 6 natural ways to help you prevent nasal congestion in a natural sense. If you love Pregnancy Pukeology Podcast, and if you love me, let me know, guys. 5-star hearts, likes for hearts, ratings, all those other stuff. But most importantly, don't forget to download this episode and share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 53, Pregnancy Nasal Congestion, and what can I take to help stop my nasal congestion during pregnancy. Until next time.
Pukeology Podcast, edutainment at its finest.